Welcome to Dishing Up Our Secrets to Success, where we interview clinicians who've been recognized as top performers within our organization. And we want to discover their recipe for success, their secret sauce, the main ingredient, you get it. So we're here to talk to them and see what they do to get such great feedback from our patients. Today we have Dr. David Byler, who's a physician in our urgent care. Dr. Byler, care to tell us a little bit about who you are?
Well, I'm a family physician. I practiced in family practice in West Virginia for 31 years. It was time to make a change and slow down some.
I feel like we should probably talk about this at some level. Tell me more about what we see on the counter.
Well, these is some of my beekeeping equipment and some of the honey my bees have produced. I've been keeping bees for the last 7 years. It's been a great outlet for me and a therapy from the busyness of my practice.
Well, let's grab a seat and we can talk some more. Let's get to the real reason why we're here. You've been recognized as one of the organization's top performers when it comes to a survey question answered by patients about how well they feel as though their provider listened to them. In fact, not only are you amongst the highest ranking providers in our organization, but you're amongst the highest ranking performers across the country, putting you in the 93rd percentile across the country related to providers who have patients answering that question. Pretty remarkable stuff. And I have to know, what's your secret sauce? What is it that you do that leads patients to feel like you're really listening to them? And why is that something that's important to you?
I don't know that I have a secret. I mean, I think we all try to listen to our patients and hear what they're saying so we know how best to treat them. But maybe some things that make them feel listened to. I think it all starts with our attitude. And our attitude translates into actions, of course. But if we come to a patient encounter with the attitude that the patient's there to give me a job or whatever, anything other than that I'm there to help them and that we're equals working for a goal of trying to improve their health today, then anything else other than that is a difficult sell to have them think that they've been heard. Also for me, I'm a follower of Jesus and base my life on that and following the principles he taught, and one that applies to this is treat other people like you want to be treated. Even if your worldview or your religion is different, it's a good principle to treat other people like you want to be treated. And so I think people can sense when we have that as our goal. I do always try to sit down to talk to patients for the history part of it, because I feel like if I'm standing up, I'm over them and kind of talking down to them, and they feel that and are less willing to open up. Sometimes even if they're on the exam table, I'm on a chair and I'm vertically challenged anyway, so I'm lower than they are, which makes it even more that they're in more of a position of power and are more able to share. But one of the things I think is having some identification with the patient. And a lot of times I will try, if they have a T-shirt on that has a college logo on or some saying, or I'll comment on it and try to make some connection there. Or with their job, if a trucker comes in, I may tell him that I've always dreamed of being an over-the-road trucker. Probably wouldn't last more than a month or two, but for a little while I think that'd be fun. Or just any way that you can identify with the person. Maybe you have to have a tattoo that you can comment on, or any kind of identification with the patient helps to disarm them and make them feel listened to. Like, this doctor knows who I am. So when I'm repeating back something to a patient, I try to adjust it to whatever medical language level they have. Obviously if it's a doctor or a nurse, I can use all medical jargon. If not, then I don't. Or if I'm not sure, then usually go with a lower level medical jargon, and hopefully the doctors or nurses are not offended by that.
I have to ask, we talked earlier about your favorite hobby of beekeeping. Are there any special lessons that you've learned from beekeeping that translate or maybe have influenced the way that you interact with patients?
Keep patients from stinging me, maybe.
There you go.
No. Yeah. Well, with listening, oftentimes I can listen to the hive as I'm working in the hive and know that they're getting a little more defensive and be a little more cautious. And in beekeeping, sometimes I say, what I need to know about this hive, I can wait till another day. I'll put it back together before they get too defensive and they get stung. But it's just importance of listening and understanding why they're doing what they're doing, why the bees they're not out there to sting me, they're there defending their hive and their honey. And the patients are usually not out to sting me. They're there to get their healthcare needs met.
Well, Dr. Byler, I appreciate you coming down today and sharing a little bit about what it is that you do to help your patients feel listened to. And thanks for the good work that you do. I know that translates to interactions with patients where they feel like they're going to have a little more confidence in what their providers tell them to do, probably a little bit more likely to go ahead and do those things. So thanks for all you do for patients.
Thank you.
Take care.
Enjoyed it.
Yeah.